Earl, I'm so excited to be here with you at the world headquarters of Medtronics and to really recognize once again the incredible gifts that you have brought to humanity. And it's a particular honor for you to participate in the Million Nurse Project of creating this global caring field, because nurses radiate caring and love every day from their heart to offer their services and gifts of caring and healing to humanity. And your work represents that same vision at another level through the science and the technology. I would just love to hear you speak a little bit more about your future for humanity in terms of health and all the future that it may bring for us in terms of other models of healing.
Well, thank you, Jean. I've had the wonderful experience of taking on the healing component of healthcare.
Yes.
Because I started out as a pure scientist. And I'm noted for my invention of the first wearable battery-operated transistorized pacemaker, which I invented in my garage in 1957. Today, Medtronic has 38,000 employees in 120 countries and helps someone in the world every 4.8 seconds with one of our devices. That's 6 million plus patients a year. I have several Medtronic parts in me: a pacemaker, an insulin pump, and 2 stents. So I'm very glad I invented the company, or I wouldn't be here. I started a company that is quite scientific.
Yes.
But yet, I, along the way, developed an understanding that there was more to curing people or healing people than just the medicine or just the device.
Yes.
What I have done over time is to go from being totally scientific to learning from some of my mentors in Hawaii that healing, really healing a person, is about 20% medicine and about 80% spirituality.
Yes.
And that within the spirituality, you have all the other kinds of healing. The massage, acupuncture, qigong, tai chi, meditation, and particularly meditation, and loving and caring, and all of the human touch components. But it's interesting, even the devices have to be put in such a way that the doctor can convince the patient they'll work.
Yes.
It isn't all just the device.
I understand.
It's believing in the device and believing in what the healthcare person is doing, believing what the nurse is saying.
And it almost becomes a form of an ethic. Once we know this science and this consciousness and this approach that integrates the high touch with the high tech, it almost becomes an ethical framework for changing healthcare in the future. And I know some of your work has actually framed some of this under the ethical as well as the philosophical as well as the spiritual and the scientific. It's all coming together and has to. And some of the work you've introduced with Code Lavender, would you talk about that a little bit?
In the hospital, we have the regular codes, like a code red
course,
or a code blue to call an emergency or a given patient. Code red in 205, and the team comes in to do something. But I wanted something that would be a call for prayer.
Yes.
And so we use patient lavender as
patient
the code.
lavender, yes.
And it means that within the hospital, that if a family wants prayer for their patient, or a patient wants prayer for themselves, they can ask a nurse or a doctor to call patient lavender on the PA system.
Right.
And we put very little on the PA system because we want to keep the hospital quiet and peaceful.
Yes.
But we do put code lavender in room 305. And that means everyone in the hospital then stops and prays for that patient in room 305.
That's beautiful.
The Mayo Clinic will be using patient lavender.
That's fantastic.
So it means that more and more hospitals are switching to using the high tech when it's right, but then adding a lot of the spirituality.
Yes, and the caring and healing.
On the 80%.
Yes, exactly.
That we want to heal a person completely.
Right. And your vision for integrating this throughout your life, your knowledge of this is really starting to be manifest in other ways now through this example, which is also very consistent with the Million Nurse Project, because the role of prayer and how, all the research that's come underneath prayer. And now many of the hospitals, from a nursing standpoint, are actually using a nursing theory of caring to guide and change and transform their practices. And they're coming up with all sorts of creative solutions that are consistent with what you're saying. But I should get them to now introduce patient lavender, because it's totally consistent with some of the other practices that they're beginning to integrate with these caring and healing modalities.
And that's partly why I started the Heart Brain Center.
Yes.
And it's funny, I had a hard time finding anyone who wanted a Heart Brain Center. I tried several hospitals here in Minneapolis, and they said, no, we want a heart center, not a heart brain center. Or we wanted a brain center and not a heart brain center, because they didn't know what heart brain was, that the heart and brain were connected.
Right, yes.
And yet we know that they are connected by at least 6 ways the heart and brain communicate.
So that's making a whole change in science and technology to make that connection.
It's a different way of thinking about how the body works.
The heart's not just a pump.
Yeah, and of course we are now including the gut
Yes,
into the
I know you
conversation,
mentioned that.
That the gut has neurotissue in it.
Yes.
And we learn that if you're going to make a very difficult decision, you should be sure you have a gut feeling that it's good.
That it's right.
And when I look back on Medtronic, many of the decisions we have made have been made according to ready, fire, aim.
Right.
And they have been gut decisions because we've made them quickly.
Well, it's such a pleasure to hear your thoughts and to what you've already accomplished, but also just your making new connections that's, I'm sure, going to be the future of medicine and our understanding of health, because we've looked at all the organs as separate rather than as one connected whole.
The nursing profession has led us to. I think working for your school was very helpful for me along that line. And that the nurses are way ahead of the doctors, or have been way ahead in the real caring and loving for the patient.
Yes, of course, yes.
So the world is changing in the way medicine is being done. So I think that has a lot to do with what we've got to do in this country and other countries in the world.
Yes.
And certainly this having a meditation simultaneously around much of the world, I think will help bring this on.
That's sort of been the devotion of my work, is to bring this model of caring science to nursing as a guide for changing practices, or being able to restore that caring and love that they have practiced across time. But they too have been, we too have been detoured away from the core of our practices, from the core of Nightingale. And part of this International Year of the Nurse, 2010 is the centenary of Nightingale. It's almost like we're having to recreate Nightingale and bring together the environment and all the statistics and all the science, as well as that vision of caring and healing and health that brings a spiritual dimension. That's why I'm using the word caritas now in my writing and work, to bring caring and love together. The Latin word caritas, to make it explicit. Caring and love go together for healing. And I just want to thank you for all the care that you have offered to the world.
One of my wishes is that as we take care of patients or participate in giving a device for patients, or like giving a device to me, that those persons around the world that get our devices are asked what are they going to do with their time that they've been given by this device, and that we will try to persuade them that it would be a good idea if they did something for humanity during this time. It could do a lot of good for the world.
Well, that is the message for the world, I think, for this time, is what we need.
Yeah.
And so you're ushering in this whole new era, and I'm so grateful to be a part of this small moment of time with you. Thank you.
Well, we're so grateful for what you're doing.
Thank you, Earl.
We're grateful for the Million Nurse Program project.
And for you to be part of it. Yes. Okay. Thank you.
Thank you.
Okay, so this is a call to action for nurses around the world to join me, Jean Watson, and Earl Bakken on January 1, 2010 at 12 noon, wherever you are in the world, to honor nurses for their caring and love that they offer to humanity every day, and to celebrate the International Year of the Nurse and the centenary of Florence Nightingale's life. You can check on this website, www.millionnurseproject.org and www.watsoncaringScience.org throughout the year for a continuation of these events that will continue 365 days throughout the International Year of the Nurse. So thank you for joining me and Earl Bakken and being a part of this global caring field project.